Now that you've completed Emergency First Response Primary Care, you're ready to complete the Secondary Care course. As you recall, this is secondary care because it follows the primary care of assuring that all life-threatening injuries and illnesses are attended to in priority order according to the cycle of care. And, as you recall, primary care never stops. You constantly monitor the patient using ABCABs and the cycle of care to guide you. However, if emergency medical services are either delayed or unavailable, you'll need the following secondary care skills. You'll practice 4 secondary skills: injury assessment, illness assessment, bandaging, and splinting for dislocations and fractures.
No. About back here.
Injury assessment helps you identify injuries that affect the patient. You can attend to some of the injuries, and you will report them to emergency medical personnel once they arrive. Remember that you always begin with primary care using ABCABs and the cycle of care to guide you. Assess the scene. Stop, think, and then act. Apply your barriers if readily available. Give your responder statement while checking to see if their airway is open and noting if she's breathing normally. Contact the local emergency medical service if at any time you begin providing primary care or you feel that you will need assistance.
Let's call for some help.
Be sure that you attend to any primary care issues before beginning a secondary injury assessment. Start by telling the patient that you're going to check for injuries. Hold the patient's head and ask the patient to keep her head still and answer questions verbally rather than nodding or shaking her head. It helps to ask questions that she can answer with a yes or no. You start your assessment at the head and work to the patient's toes. If the patient complains of head, neck, or back pain, stop the assessment immediately and keep the patient immobile until help arrives. Feel for deformities on the patient's face with a gentle touch. Check the ears and nose for blood or fluid. See if the patient's pupils are the same size and have her follow your finger with her eyes without moving her head or neck. Check the eyes for smooth tracking. The eyes should track together. Also, check pupil size. Feel the skull and neck for abnormalities. If the patient complains or you find something, stop the assessment. Slide your hands over the shoulder blades and gently push against the back. Press inward on the shoulders and run your fingers over the collarbones to the center. As you perform these steps, you're looking for irregularities or blood, or for the patient to mention pain or other unusual sensations caused by your touch. Stabilize the patient's arm with a hand on the shoulder and slide your hand gently down the upper arm, elbow, and wrist. Repeat on the other arm. Ask the patient to wiggle her fingers on both hands and squeeze yours to check for paralysis or weakness. Inspect the chest for deformity. Place a hand, palm in, on each side of the patient's rib cage and gently push inwards. Gently put your hands under the patient to check the spinal column. Cover as much area as possible without moving her. If you find any irregularities, stop the assessment. Ask the patient to tell you if she feels pain. Gently push on the patient's abdomen on the right, left, and above and below the navel. Move hands gently over the hip bones to check for swelling or hardness, tissue softness, unusual masses, joint tenderness, and deformities. Avoid pushing inward on hips. Ask the patient to wiggle her toes and press her foot against your hand. Repeat this with the other leg. After your assessment, you will attend to the injuries you can. Otherwise, continue to monitor the patient using the cycle of care to guide you, and report what you found during the assessment to emergency medical services personnel. Illness assessment helps you find and report medical problems that affect the patient's health and may aid with treatment. You'll assess the patient by asking questions and by checking the patient's breathing, pulse, temperature, and skin. In class with your instructor, you'll practice an illness assessment on a healthy person. Assessing a healthy person may help you recognize differences later if you assist an unhealthy person. As you've learned, you start with primary assessment. After giving the responder statement and assuring that the patient is responsive and breathing normally, get something to write on so you or someone assisting you can record what you find. There is an illness assessment record sheet in your participant manual. To help you remember how to begin an illness assessment, use the mnemonic SAMPLE. The S in SAMPLE stands for signs and symptoms. A stands for allergies. M stands for medications. P stands for pre-existing medical history. L stands for last meal. And E stands for events. The S stands for signs and symptoms. Signs are something you, the rescuer, sees. Symptoms are something the patient tells you he's feeling. Ask the patient how he feels and what happened right before getting ill. Ask, how do you feel now? Next, you'll check the patient's pulse. Find the pulse on the patient's wrist. Feel the pulse with your fingers, not your thumb, and count for 30 seconds, then multiply by 2. The typical adult pulse rate at rest is 60 to 80 beats per minute. Next, you'll check the patient's respiration. As you do this, remember the typical adult breathing rate at rest is 12 to 20 breaths per minute. Someone breathing markedly faster or slower may have a medical problem. To check the breathing rate, watch the patient's chest or place a hand on it while timing for 30 seconds, then multiplying by 2. Attempt to check a patient's respirations without them knowing you are doing so. Listen for wheezing, gurgling, or high-pitched noises. Note if the patient complains of short breath, dizziness, lightheadedness, chest pain, or numbness, or tingling in the arms or legs. Next, check the patient's temperature and moisture. Feel the patient's forehead with the back of your hand. See if it's warm, hot, cool, moist, clammy, etc. Check the patient's color. Is it pale, ashen, reddish, bluish, or yellowish? Does it have blotches? If the patient has dark skin, check for color change in the nail beds, lips, gums, tongue, palms, whites of the eyes, and earlobes. Usually, an adult at rest should have skin that's warm and dry to the touch. Noticeable changes in temperature, moisture, and color may indicate problems. Next, check the patient's eye pupils. Are they enlarged? Small? Unequal? Any of these may indicate problems. Also in the mnemonic SAMPLE, the A stands for allergies. Ask the patient about allergies to medications, insects, food, or the like. Ask the patient, have you been exposed to something you are allergic to? While talking to the patient, look for medic alert bracelets. Has the patient been bitten or stung by an organism? If so, and the allergic reaction is severe, treat the severe allergic reaction as a medical emergency and follow primary care procedures. A severe allergic reaction, anaphylaxis, can be treated by epinephrine. People who have suffered a prior episode of anaphylaxis often have prescribed an auto-injector of epinephrine. Have the patient use the auto-injector or assist them with its use. Next, the M stands for medications. Ask the patient if he takes any medications. If so, ask, what medication do you take? Did you take it today? How much did you take and when? If possible, get the patient's medication so you can turn it over to emergency medical personnel when they arrive. The P in sample stands for pre-existing medical history. Ask the patient if he has any medical conditions like asthma, epilepsy, heart conditions, or diabetes. The L in sample stands for last meal. Ask the patient, when did you last eat? What did you eat?
And any other events that you could think of that led up to this?
The E in sample stands for events. Ask the patient about or note the events that led up to the illness. Bandaging helps control bleeding, immobilize the injury, and reduce dirt or other contaminants from entering a wound. It's a skill that can range from life-saving in the case of serious bleeding to simply helping the patient feel more comfortable. After attending to primary care and injury assessment, you may apply roller bandages directly over a sterile dressing on a wound. As you recall, once you have a dressing in place, you don't remove it. Start below the wound and wrap upward over it. Wrap tightly enough to hold the bandage snugly in place, but loose enough that it doesn't restrict circulation. Leave fingers and toes exposed so you can check them for proper circulation. If you're bandaging a foot, start with a couple of turns around the ankle, then over the injury site on the foot. Similarly, start a hand bandage around the thumb and wrist. Elbow and knee injuries normally call for wrapping above and below the joint to stabilize the injury. Triangle bandages support injuries to the arm, ribs, or shoulder. Start with the bandage top over the shoulder on the affected side. Bring the arm over the bandage, then bring the low end of the bandage up behind the neck and tie it off. Support the arm and hand with the fingers showing. If you suspect broken ribs, tie a second bandage to hold the arm against the injury side of the chest. This helps immobilize the entire affected side of the torso. The pressure immobilization bandage is a treatment for snake bites and a specific list of injected venoms by other animals. Other than snake bites, check with local medical authorities prior to using this bandage for other envenomations. Ideally, select a broad elastic bandage if available. You may improvise by using any flexible material such as clothing or towels that could be torn into strips of at least 7 centimeters, 3 inches long. All bandages should be applied as firmly as you would apply a bandage to a sprained ankle or wrist. Apply the bandage as soon as possible after a bite. Also, avoid taking off clothing and having the patient move. If the bite is not on a limb, simply apply firm direct pressure on the bite site. If the bite is on a limb, begin bandaging at the fingers or toes and continue upwards as far as possible and including the bite site. This method of immobilization bandaging restricts bodily fluids from flowing into the limb, reducing the spread of venom. By adding a splint, you further reduce joint and limb movement and venom flow. Bind the splint to the limb using more of your bandage, like this. Once on, do not remove bandages or splints. Seek medical attention as soon as possible. Splinting immobilizes broken bones and dislocations. This reduces the risk of further injury and serious bleeding and lessens the pain for the patient. You may need to apply a splint if emergency medical care is either delayed or unavailable. When needed, splinting follows all primary care concerns, injury assessment, and any necessary bandaging. Splint the injury in the position you find it. Don't try to straighten it, and try to minimize moving the affected limb before you splint it. You can use a commercial splint or improvise with almost anything rigid. Choose a splint long enough to immobilize joints above and below the injury. Pad the splint with extra padding inside body curves and hollows for even, comfortable contact with the splint. Bandage the splint in place using a roller bandage, adhesive tape, or other material available. It should be snug enough to immobilize the injury, but not restrict circulation. Check the pulse before and after splinting for blood flow. Gently squeeze the patient's fingertips or toes and check that the nail beds immediately regain their color. If not, or there's no pulse, loosen the bandages so normal circulation returns. If the fracture involves an arm, you can put the arm in a triangle bandage after splinting. One important point, do not splint if doing so increases patient discomfort or pain. Now that you understand the 4 secondary emergency first response skills, let's apply them to some realistic situations. Note in each scenario that the emergency responder first attends to any primary care issues using ABCABS and the cycle of care to guide him. Second, he confirms that EMS is either delayed or unavailable before moving into secondary skills. The emergency responder takes a moment to assess the scene. He stops, thinks, and then acts.
Hey there. Looks like you took a little spill. My name's Pat Jones. I'm an emergency responder. May I help you?
Yeah, I think I broke my arm.
Yeah, anything else hurt here?
Because the patient is responsive and talking, the emergency responder knows that the patient has an open airway and is breathing normally.
Okay, just relax and try not to move, okay? While I try and get help.
Okay.
No service. Guess I won't be able to get emergency medical services here. But it's okay. I can assist you. Try not to move your head at all.
Okay, all right.
Let me take off your glasses, okay?
All right.
You doing okay?
Yeah.
All right, open your eyes and try not to move your head while you look at my finger. Perfect. Let me check your ears for you. How's your head feel?
It feels good.
Any pain when I'm feeling this?
No.
What about back here? Nothing?
That's fine. That's fine.
Okay. How do your shoulders feel?
I feel okay.
Okay. Any pain?
No.
Nothing?
No.
Okay, how you doing, okay?
Okay.
Don't move your head. How's that feel?
That's okay.
I'm going to check your spine for you, okay? Tell me if you have any signs of pain. Anything?
No.
Okay. And check your abdomen now. Does that hurt?
No.
Here?
No.
Here?
That's okay.
Here?
It's good.
Okay, I'm going to check your hips. How's that feel?
It's okay.
All right, I'm going to go down to your legs now. Feel any pain here?
No.
Anything?
No.
Wiggle your toes for me. Okay, let's do the other side. How's that feel?
Feels good.
Can you wiggle your toes for me? Okay, which arm hurts?
It's my right arm.
Okay, I'm going to leave that alone for now, and I'm going to bandage this cut first. Then I'm going to splint your other arm, okay? That should make you more comfortable, all right?
Okay.
Let me get the splint. I'll be right back. I got a blanket for your head, okay? Let's move this out of the way. I'm going to easily move up your head. Okay, lift it up slightly. Okay, set it down. How's that feel?
That's okay. It's good.
Okay.
It's good.
Let me see. Let me see this arm. Try not to move your head, okay?
All right.
All right. So what were you doing out this morning? Just going for a bike ride?
Yeah.
Yeah? What'd you do? Hit a rock? Didn't see it or something?
I don't know.
Yeah. This should make you feel a bit better, okay, buddy? What's your name?
Eric.
Yeah? How you feeling?
It's just my arm, man.
Yeah. Looks like you took a little bad spill on that side. I'll get to it in just a second, okay? Doing okay?
Yeah.
All right. Just about done here. Okay, I'm going to splint your arm now, okay? You help by moving your wrist area, and I'm going to move your elbow up, and I'm going to slide the splint underneath your arm, okay? The count of 3. 1, 2, 3. I know it hurts. This will make it feel more comfortable. Good. Let's move it across your chest slightly. Okay, I'm going to tie the splint now, okay? You doing okay?
Yeah, yeah.
All right, I know this hurts, but it will feel better. All right. Look, we're pretty far away from emergency medical services, okay? And I can't get any service down here. I can take you, or I could go get help. I think it'd be fastest if you come with me. Are you comfortable with that?
Carrie, are you okay?
Oh, hi, Marino. Just something I ate.
Well, you don't look well at all. Look, I'm an emergency responder. Can I help by taking your pulse and other things just in case?
Yeah, but it's really just lunch.
See, well, what did you have for lunch?
The usual. Salad with dressing.
Well, your pulse is 110 and your respiration is 22. When did you start to feel ill?
About an hour ago.
And how do you feel now?
About the same.
Are you taking any medication?
Blood pressure stuff.
Have you taken any today?
I took it at lunch. I just started a new prescription.
Do you have the prescription with you?
Yeah.
Carrie, have you been doing any exercising in the last minutes before I came in?
No.
Well, your pulse is racing, you're breathing heavy, and you're cold and clammy. As a precaution, I think we should get you checked out.
I don't think it's anything.
I'm sure it's not, but just in case.
Okay.
Yes, can you call the emergency response team to Carrie Tull's office? Yes, he's feeling more than mildly ill. No, I'm okay here. Just make sure you bring them back here as soon as they arrive.
As an emergency responder, you play a crucial role in a medical emergency. Your primary care response skills are the critical first links in the chain of survival that summon emergency medical services and monitors the patient, providing aid that increases the chances of survival or revival. In emergencies that are not immediately life-threatening, you provide comfort and reduce the risk of permanent disability. Your emergency first response secondary care skills can benefit patients by alerting medical personnel to conditions that need attention, by reducing further injury, and by increasing patient comfort. As you've already learned, few emergency responders ever need their skills. But if you ever do, you'll be ready to reach out and help another in need.